I want to talk about the surgery centers. I know the last couple of years there's been some tax questions on them, but mine's more based on, the ambulatory surgery centers are governed by health rules that were created back in the 1990s. So that's, we're talking 25 years ago. And since that time, the regulatory process doesn't seem to be quite as nimble. I mean, these surgery centers have been, there's great advances in technology, which and I do think they serve an advantage here in the Commonwealth. And just 2 years ago, two and a half years ago, the Department of Health and the surgery centers worked collaboratively to update, a piece of regulations extending the length of stay in a surgery center. And, for a long time, Pennsylvania's been very restrictive in this area. And I'm just wondering, Medicare is not quick to approve certain procedures. We have people from the Commonwealth that are going to, I live in Lancaster County, they go to Maryland or Delaware or something like that. And I was just wondering, unless you know otherwise, it seems like they've been pretty successful. The infection rates are low and what have you. Is there going to be an opportunity moving forward for the department to work with the legislature and also, I guess, the industry to help with some of the regulatory challenges that are occurring right now?
I'll start.
Sure, yeah.
So you're entirely correct. The last ASF regulations were promulgated in 1999, and so things have changed in 20 years and 21 years. So it is really challenging. We have a very ambitious regulatory agenda. The hospital regulations have not been updated since 1984, and the nursing home or long-term care regulations have not been updated since the late 90s as well. And we also have to promulgate the new the final medical of marijuana. So we have a very ambitious regulatory agenda, and so ASF is in that queue, but as you know, as you said, the regulatory process is not nimble. To that end, we have a very robust exceptions process, and I'm going to let Sarah kind of talk about that process and how we've improved that process.
Yeah, so there's a unique piece of the Healthcare Facilities Act that allows a facility to request an exception to the regulation, and that moves through a process at the Department of Health. So, for example, vascular procedures were something that was of great interest to ambulatory surgical facilities. So we created a document that outlined really what we'd be seeking in an exception, so that a facility could use that as a roadmap as they were preparing that documentation to streamline that process and turn those around quicker for facilities. Through that effort, as well as through the governor's commitment to lean and performance improvement, we actually have asked our Director of Operational Excellence, Brian Lentis, to apply lean principles to the exceptions process. That project is ongoing right now. This way we can ensure that when facilities need to, as we work to promulgate new regulations, use that process, that they get those answers quickly, that they are clear, and they can start doing procedures that are deemed appropriate to be done ambulatory.
When did that start? I mean, when did that process start? Because just recently, probably.
Well, so the exceptions process has existed. It's from the Healthcare Facilities Act. The vascular guideline publication was, maybe a year ago or so.
Yeah, I was going to say, but the timetable can be long with Medicare and what have you. I'm saying that's, people say they want something done, and if it's not done in a timely fashion, people want to go elsewhere to get their procedure or surgery done or something like that.
Yeah, so the payment mechanism would be beyond the Department of Health. So if it's CMS who's saying they are not going to pay for a procedure in this particular location, that's beyond us. But we have the regulatory ability to provide an exception when appropriate.
Yep, like I said, when I asked the question, I think you answered me. It's hospitals, it's surgery centers, it's everything, and it's somewhat the nature of government. We tend to be more. It takes us time to steer this battleship, but I appreciate the answers and you taking the time to be here today. Thank you, Mr. Chairman.